Hey everyone, welcome back to the Better Arizona Show. I'm Sarah Carlstrom. At some point in all of our lives, provided we live long enough, we will all have cataracts, which, by the way, is the leading cause of blindness around the world. Not here in the United States because there is a surgery to correct the problem, and technology has really changed when it comes to cataract surgery, and that's what we're talking about today. We're talking with Dr. Neil Adadaria here at Barnet Dulaney Perkins, and we're talking about cataract surgery. We've all heard of cataracts before. Quickly, what exactly are cataracts?
So basically, a cataract is the lens inside the eye that begins to opacify over time, or it's essentially, imagine like you're looking through a window that becomes dirtier and dirtier over time. So it's inevitable. It's something that we all get eventually.
It will. It will happen to all of us.
Correct. If we, like you said, if we live long enough, it is something that you will get, and so in a way, it's something you want to get because you want to live long enough to get to that point where it can be corrected very successfully nowadays.
Well, let's talk about surgery because technology has changed a lot. In the past, you would, as a doctor, just go in and manually take the cataract out?
Absolutely. Before, we would use our blades and our hands, of course, to make rather large incisions into the eye, then manually remove the cataract and then replace it with a new artificial lens. Over time, the technology has become to the point where we can get faster recoveries and more precise results with the technology that's available today. And there's a variety of technology that fits into the framework of how we do cataract surgery. For instance, one of the biggest things that we have just undertaken at Barnet Dulaney Perkins Eye Center here is that lasers are now used to help remove cataracts. And before, it was all done with an ultrasound procedure that helps to remove the cataract. We still keep that piece of equipment, but we now add a laser to it that tries to give us more precise results. For instance, the LensX laser system allows us to make the incisions into the eye and also starts to help dissolve the lens before we've even gone into the eye, so that when we go inside the eye to remove the cataract, it becomes a more straightforward and hopefully a more or an easier process to remove that cataract. That gives the patients more precise results after the fact, as well as a quicker recovery. The toric lens is a bit of a game changer as far as if a patient has a moderate degree of astigmatism, now you can correct it with cataract surgery like you normally would, but we have the technology with this lens to correct the astigmatism to almost nil. And then the next lens is called a restore lens or a multifocal lens. That's a type of lens that tries to give patients the ability to see far away and up close to try to restore almost what our natural lens should work like.
What is Aura? Tell me what that is.
Aura is a low-energy laser that takes a measurement of the eye and confirms, am I putting the right power inside the eye, or do I have to adjust it?
So and everything is just, it's a game changer, like you
exactly
said.
Right.
Technology's made the procedure easier, it's safer, it's probably faster, and then people
and
are
more
walking
precise and more accurate kind of results that we get, absolutely.
And one more thing we talked about before, doctor, it's so important with cataracts, if we all live long enough, we're going to get them, but you have to go to the eye doctor, because if you wait too long, everything just becomes a little bit more difficult to treat. Thank you so much, and people sitting at home thinking, I'd like some more information, you can go to their website at goodeyes.com. Everything in life seems to get a little easier with technology. Thank you so much, doctor.
Thank you.
And the Better Arizona Show will be right back.